All right. I think we're just going to start now and allow others to join as we go. So welcome back to Advancing Health Equity Together seminar series. This is a bi-monthly seminar series that we host. To anyone who's joining for the first time, this is an opportunity to learn the basics about community engaged research, learn about different strategies and approaches to conducting community engaged research, and really reflect on how you could implement or integrate some of those approaches into your own research. Today's focus is going to be on community needs assessment. We're just going to start with a generic and basic introduction to kind of just lay the background in context for the panel discussion that we'll have following that. And we'll end with a Q&A. So if you have any questions come up as the session goes on, please feel free to drop them in the chat, or you can also just unmute yourself and ask the questions when we get to the Q&A session. So just to, kick us off, with what, just generally, what is community needs assessment? And it's really just a systemic process that helps us identify the needs of a community, resources within a community, and if there are any gaps, to meeting those needs. And it can be conducted on a population level, community level, organizational level. It really just depends on what our focus and interest is. And, it's just specific to our interest and outcomes of that we want to focus on. However, a very important and crucial factor in conducting community needs assessment is to make sure that we are engaging community partners from the very inception of the project. And this is to make sure that we have an authentic insight, culturally relevant outcomes that are informed by the community. And this all allows us to foster bidirectional trust, which is very important to make sure that the process is sustainable, whatever project we're working on is sustainable, and ultimately leads to community self-empowerment. So overall, community engagement in needs assessment leads to solutions that are more aligned with the real needs, more acceptable by those who are affected, and are more likely to succeed. And this slide just gives us a generic framework on the various steps that we can take in conducting needs assessment. Here we just have presented the ACCESS stepwise guidelines, which is to include community partners and identify community partners early on in the process, and then collect community data. And this can be primary or secondary data through various methodologies that we're not going to delve deeper into. We're not going to get into today, but that also just depends on the focus that we have and how what we're trying to target. And then we get into data evaluation to determine key findings, and that really helps us identify priority areas. And then as a succeeding step, we have the program planning and implementation, but it doesn't end there. We have to also go back and make sure we evaluate the progress and do all of the steps all over again. It's a very cyclical in nature, and that's where the sustainability component of it comes in. So there are different ways to conducting needs assessment, and we're going to hear a whole lot more from our amazing panel today. Our panel today, we have three amazing people joining us. Thank you so much for being here. We have Luz Guel Salazar, who's the Director of Community Engagement and Environmental Justice for the Center on Health and Environmental Across the Lifespan in the Conduit Institute for Translational Sciences at the Icahn School of Medicine at Mount Sinai. As an educator, facilitator, and researcher within Mount Sinai's Department of Environmental Medicine and Climate Science, Luz uses community-based participatory research and anti-racist approaches to collaborate with New York City communities to address environmental injustice. Thank you so much, Luz, for joining us. And secondly, we have Dr. Tanya Batres, who's a doctoral graduate from Long Island University School of Social Work. She's the manager for workforce development and legal services at Voces Latinas, a community-based organization specializing in working with Latina community. Her experience and expertise as a social worker highlight working with forensic populations, substance use treatment, and underserved communities. Her passion in helping others is to empower themselves through education and community health work. And last but not least, we have Carrie King, who's the director for Uptown Grand Central and brings a wealth of experience to the organization. A graduate of Harvard University's Graduate School of Education and product of Columbia University School of Journalism, Carrie has worked in fields ranging from community development and food access to community news to inclusive education, including Grow NYC, the Corbin Hill Food Project, Sesame Street, the Silva Herald, and as a pre-K teacher through Teach for America. Carrie brings a special passion to her work, given that she lives just 1 block away from the East 125th Street corridor and the Uptown Grand Central Community Plaza. Since joining Uptown Grand Central in June 2015, has been recognized by the New York NYPD 25th Precinct Community Service Award, named by Borough President Gail Brewer as a Manhattan hero, and by the New York City Food Policy Center as a 40 under 40 Rising Star, and selected as a core New York neighborhood leader. We're so delighted to have you all today, and we're pretty sure that we're going to gain a wealth of knowledge from you all. So without further ado, I'll pass it to Luz to kick us off.
Perfect. Thank you so much. All right, let me get started and share my screen. All right, all good? Everybody can see it?
All good.
Perfect. All right. Well, good afternoon, everybody. I'm very, very excited to be part of this panel today. My name is Luz Salazar. My pronouns are they, them. I'm the Director of Community Engagement and Environmental Justice for our HEAL Center, and also for our CTSA program here at Mount Sinai. And today I'll be sharing our story and journey of a community needs assessment partnership in Jamaica, Queens, that ends up speaking to the importance of addressing and prioritizing community concerns in academic community partnerships. And so our journey started with a phone call between Andrea Scarborough and CUNY School of Law professor Rebecca Bradspies, who is a longtime partner of our Mount Sinai team. And Andrea, who is a longtime environmental justice activist, reached out to Rebecca Bradspies and shared with her that she was having issues with waste transfer stations and that she would like to explore a partnership with public health professionals and other interdisciplinary partners to be able to address some of these public health concerns associated with waste transfer stations. And so then Rebecca ended up connecting Andrea to our team, and that's really where our partnership started, was in summer of 2020. And so before we even begin, what are waste transfer stations that Andrea has been referring to? So, and also why are they placed in residential communities like Jamaica, Queens? So when the Fresh Kills landfill was closed in 2001, it was in Staten Island. It was at one point the largest landfill in the world. When it was closed down, private waste transfer stations started popping up across the city, where then they began to process New York City's residential waste, and then they would sort it, pulled it, and then trucks were exported out of state to other out-of-state landfills. And so when we start looking at where these waste transfer stations were located and how they continue to impact the health of residents, we can see that it's primarily located in 3 neighborhoods across New York City. That includes the South Bronx, Jamaica, Queens, and North Brooklyn, which are all predominantly low-income Black and Brown communities. And this practice is a form of environmental racism, where there is an unequal distribution of environmental hazards based on race. And this results in communities of color being disproportionately exposed to pollution and other environmental harms. And so going back to the question as to why were they placed in Jamaica, Queens, we can always trace back the roots of these inequities to discriminatory practices, such as redlining and other racist practices that have led to the disinvestment of neighborhoods and have made Jamaica, Queens a sacrifice zone. So when the New York City Department of Sanitation was trying to determine where should we place these environmental polluting facilities, most likely they're going to be placed in these sacrifice zones that have been formally disinvested through discriminatory practices such as redlining. And so knowing all of this history, an interdisciplinary team was formed to be able to organize for environmental justice action. And our team includes air quality experts, community leaders, public health professionals, lawyers, and youth leaders from a local high school. And we truly are so grateful for this intergenerational partnership that has taken us on many ups and downs on our journey to be able to get environmental justice action in Jamaica, Queens. And one of our first steps in forging this partnership was having community leaders lead a community tour to highlight environmental concerns and also areas of strength across the neighborhood. And so some of the concerns that the community leaders listed were there was a cement facility that was situated right next to a dialysis center and mental health services. Also, there were trucks that were coming out of these waste transfer stations and driving through non-truck routes, which means they were polluting the local air where they were not supposed to. And also they ended up citing that there was a lot of illegal dumping of cement in a lot of the tree beds across the neighborhood. Additionally, here's some more pictures where the community members also wanted to, like I said, highlight what are the strengths in the community. And so like I had mentioned, there's a kidney dialysis center and also a bus stop that are right next to each other, and they're placed right next to a cement facility. And so for us, as we're trying to figure out how we're going to collaborate together, we want to make sure that these areas of health services and strengths are also protected as we're doing and taking this research to action. And so after the tour, our group set out to map out the local pollution sources and also community assets and strengths. And as you can see, the majority of the pollution sources are located along Liberty Avenue. So here's Liberty Avenue. You see all of these different bus stops. And so a lot of these pollution sources are not just the waste transfer stations, like I had mentioned. There's also cement facilities, a live poultry facility, a bus depot where public transportation buses from the MTA go and get stored. There's also auto repair shops, scrap metal facilities, and this is all across the street from a residential neighborhood. So for us, we wanted to start visualizing where are these areas of strength and how can we make sure that they're being protected from all these different environmental harms across the neighborhood. And so when we were trying to prioritize which of these different community concerns we should focus as part of our partnership and as part of an application for a pilot project proposal, we ended up deciding to first list all of the community concerns associated with the waste transfer stations. And as you can see here, there's a lot of issues associated with the waste transfer station, and we only have very little time and very little money to be able to address all of these. So how do we prioritize this? So then the community ended up deciding that they were gonna develop a list of criteria that they were going to pick from, and they were going to prioritize these community concerns by evaluating them based on this criteria. For example, the importance of the problem to the community, the severity of the issue, the likelihood of long-term health impacts, and if the solution could end up impact multiple problems. So can the solution really make sure that it's addressing health, environmental concerns at the same time? And so using this criteria, we had two separate ranking systems, one by the community leaders and another one by the interdisciplinary partners. And so the reason we ended up doing this is that we wanted to make sure that the community voices were the ones guiding the prioritization process as to which of these concerns should we focus on. And the partner scores were then consulted only when the community needed additional guidance of where to place them in this spectrum of ranking. And as you can see, the group ranked these concerns so differently from each other. But ultimately, what I want to highlight from this particular slide is that as researchers and folks that work in academia, it's really important for us to develop participatory methods and include participatory methods that end up challenging the investigator-led research paradigm. So most of the time we come in communities and tell them what they should be focusing on. And so for us as researchers, I really encourage all of us to think about participatory methods like this one, where we end up centering the lived experience and community knowledge as valuable as a PhD and a master's degree in academia. And so here you can see the final ranking process where the community member decided that odors, PM 2.5, and truck traffic were going to be the main focus as part of our pilot project application. It doesn't mean we're not going to address the rest of the concerns, but for this particular application, we're going to focus on this and then continue to have other efforts so that we address the rest of the concerns that are listed here. And once our data collection and analysis was complete for this pilot project, we also began to collaborate with, again, the areas that are a source of strength in the community. And one of them is Shiloh Baptist Church that has been in Jamaica, Queens for a very long time. And many residents end up organizing here in particular. So we partnered with the pastor there to be able to share our research data results during the Sunday Mass. And here you can see us joining the community members and the pastor in a prayer circle focused on environmental justice to be able to ground us as to what do we envision Jamaica, Queens to look like so that it looks like environmental justice. And additionally, we also wanted to make sure, again, that we took this research to action. So we held an event at the local park, which again is a very big strength in the community. And what we wanted to hear from community members is, what solutions do you want to see implemented to be able to have a greener neighborhood here in Jamaica, Queens? And so once we ended up sharing these research findings, they ended up voicing to us that they really wanted us to construct green walls and have green job opportunities around the pollution sources. So that would be one of the most immediate ways that we can reduce some of these impacts, is by constructing something like that right adjacent to these waste facilities. And here you can see again how the community park is a very, very valuable asset. Most community members, when we surveyed them, they would frequent the park almost daily or at least weekly. So here you can see where potentially these green walls would be constructed with native vegetation, and also provide workforce development opportunities for local community members to help us with a design process. And we're working with the waste transfer stations and also these other polluting facilities that I had mentioned to you all before, to think about how do we construct these green walls so that there's an immediate barrier to these pollution sources. And so just to end this presentation, I wanted to just highlight that our partnership journey has not only just included research that I have mentioned to you all, it also has included opportunities to inform decision makers by participating in hearings, such as the waste equity law and the zero waste law. Also opportunities to be able to train researchers in how to work with community members. So we were able to develop a curriculum, how to do so. And then also publishing our essay, our process in an essay form, not necessarily through a peer-reviewed process. So we have an essay called No Sacrifice Zones for Research Either. And you should be able to access it online. And it was co-written by myself and the rest of the community leaders to share our process. And lastly, what's really exciting is that this project has led us to another 3-year funding opportunity so that we can continue to monitor air quality in Jamaica, Queens, and address some of the other environmental concerns that were listed as part of that spectrum. So with that, I would like to thank everybody for this presentation, and also the amazing folks that are part of our team with which this work would not be possible. So thank you.
Thank you so much, Luz. That was amazing. I'm sure we have so many questions, but we'll save for the end of the session, and now I'll pass it to Tanya Batres.
Thank you. I'm going to share my screen as well. Sorry. Sorry, I'm having an issue here. Okay. So we will be discussing a little bit of information about Voces Latinas. Voces Latinas is a community-based organization that's located in Jackson Heights. Can you all see my screen?
We can.
Okay, perfect. So my name is Tanya Batres. I am a doctoral social work student. My pronouns are she, her, ella. I'm currently the program manager of Voces Latinas for the programs of workforce development, legal services, and promotoras. And I want to talk to you guys a little bit about our organization. So Voces Latinas was founded in 2003 with a mission to reduce HIV, right? The organization has always been an HIV prevention focused lens. And in our journey, we have noticed that there was additional services that people that are living with HIV needed. And one of the most prevalent was violence. And through these programs of Voces Latinas, we try our best to empower, educate, and provide leadership and advocacy trainings to everyone in the Latino community, regardless of their documentation status. And the idea is for them to be able to equip themselves with tools to make informed decisions for themselves and for their families, making sure that they meet their basic needs outside of clothing, food, shelter, but other social determinants of health as well. Our mission and vision focuses very, very strongly on providing culturally and linguistic appropriate services that focus on prevention, advocacy, and the well-being of immigrants and underserved populations. Our work is deeply driven by the commitment to address unique challenges faced by community members, especially those that now are seeing a huge influx of newly arrived migrants. So we're ensuring that they have access to resources that they might need so that they can thrive in a new country. And we strive to dedicate community services and create a social impact. We always advocate for those who many times prefer to be invisible because they have a lot of things on their plate where they feel like at any point in time that they can be removed from their families or from the country. So it's a lot of things that impact their life, including their mental health. So what are our programs at Voces Latinas? We have 5 essential pillars of programming. We have our sexual health and wellness, where we provide HIV testing, linkage to care for those living with HIV, STI screenings, and linkage to treatment for anyone who has a reactive response, connections to PrEP and PEP, HIV navigation services, connections for reproductive health and women's health for both cis and transgender women, mental health counseling, and we have art-based support groups, our Manualidades group, where people come together and they do activities that are related to art, whether it be knitting or creating sculptures, jewelry, and the women come in and they feel comfortable to be able to share their needs for support. We have our healthcare services team, which focuses very much on NYC Care, a health program for those who do not have a documentation status or are unable to afford Medicaid or health care access. We also have our New York State of Health Insurance Enrollment Program, SNAP enrollment, immigrant referral services, LGBTQIA+ health access, our Access Health program, which is presentations and workshops, and our Global Health Initiative, where we have residents from Mount Sinai and from Elmhurst Hospital come in and see how we are culturally responsive to the community that we serve. And hopefully it's something that they can take back with them to their practice in the hospital. We have our workforce development program, which not only trains community, also trains promotoras and increases their development in the workforce. We have a job readiness and capacity building program, and we also provide case management and also a mental health support group. Our immigration legal services are also right now supporting work authorization, asylum applications, change of address, UNT visas, TPS, and supporting now in year 2, the CBP-1 application support. And we also have our domestic violence program, which includes case management, safety planning, shelter placement, and mental health counseling. And we're only growing. So in terms of the topic for today, where we're talking about needs assessments, Voces Latinas has created what we're calling our welcome form. So in this past year, we've introduced what we're calling our welcome team, which consists of promotoras who engage community as soon as they arrive into our office, an intake specialist who supports them with creating their profile and connecting them for internal referrals, and a community benefits advocate to provide clients in need of support for beyond Voces Latinas. You know, Voces Latinas isn't able to assist in every aspect that clients might have a need for. One in particular is housing. So in this space, we have our community benefits advocate who does all external referring for clients who are in need of support outside of the scope of the work that Voces does. And in the implementation of this welcome form, we've started to see a lot of different needs and needs that necessarily we might not be thinking of. And then the way that we're trying our best is to update our data, get as much information as we can from clients to see how we can better assist their needs and better advocate for support and funding in those areas. And this is my contact information, should anyone want to refer a client, if there's any questions that you might have. And this is my email as well, just to facilitate that as well. most. Thank you so much.
Thank you so much, Tanya. That was very insightful. And now we'll have our last panelist, Carrie King. Do I see her on the screen? Yes. Oh, I think you're muted. We cannot hear you yet. I think you're still muted.
There we go. Okay. So I am
Amazing.
trying to run a farmer's market at the same time. So give me like 2 minutes. I've got to just pull my computer down and I'll be right back. Just give me a sec.
While we wait for Carrie, does anyone have questions that they'd like to ask Luz or Tanya in the meantime?
There is a question that came in for Luz, and I'm just going to read it. And it says, can Luz speak more on how to affect changing policy in the institutional and structure of racism that oppresses these communities? As research funding comes and goes, do we require more community engagement with agencies and politicians who set policies that affect them?
That's such a great question. And I feel as though for a lot of us who work at these intersections of social justice, environmental justice, and research, we have many different responsibilities and many different hats that we wear. In a conversation that I have a lot with folks who are at these intersections, especially folks who have marginalized identities, I think for me, the way that I traverse through academia looks very different than some of my other coworkers. And so I have to acknowledge how some of these different spaces are not necessarily the right structures to be able to support the work that I'm doing in the community. And so vice versa, some of the community work that is happening at the grassroots level is not necessarily going to be uplifted as much in academic spaces. So I think for all of us, as we're thinking about our positionality in all this work, at least for me, I try to balance not only my own structural position and privilege from academia and recognizing that I do have that privilege while also simultaneously knowing that in that hierarchy of academia, I'm all the way down. I don't have that power. So that means that there are certain things within academia that I structurally can and can't change. And then there's certain things at the community level that I can and can't change. So I personally have focused most of my efforts at the grassroots level rather than the academic structural system. And again, this is just my personal capacity of being able to address all these issues. I wish I could address everything, but what I've been doing mostly is working in solidarity with local decision makers and council members and letting them know, bringing them along to community tours, bringing them along to share the research results. And that has led us to being able to stop more waste coming into Jamaica Queens. And so it was because of those efforts organized by that grassroots level that we were able to actually implement some action at that structural level in the community. So now Jamaica Queens is not going to receive more waste, which is a very, very big deal knowing that so much of our waste gets put there in North Brooklyn and the South Bronx. So that again is how I end up navigating, and I think so many other folks end up navigating it very differently. But for me, that is where I end up focusing more of my energy, is doing that grassroots level work and ensuring that that research then gets translated into action. But bless all the folks that are working in academia changing the structures, because I know how challenging that also is.
Yeah, I think that's a testament that it's really like a joint effort for everyone to work together and, like changing the systems in place. But I see Carrie has joined now, so I'm just, gonna let her take over.
Thank you. Sorry, guys. We had a lot going on at the market. We had somebody did a pop-up art installation. There was a lot going on. Cooking demonstration. So I was trying to leave, but I didn't get a chance to yet. So hi, my name is Carrie King. I am the director of a nonprofit called Uptown Grand Central. And we work along the East 125th Street corridor in East Harlem to do things like street cleaning and public art. We got our start when small businesses got together along the corridor. How many of you are familiar with East 125th Street in East Harlem? Some of you may be. It's a pretty unique place because there is a very, very high concentration of people in need, mental illness, homelessness. We have the N35 bus that comes from Randall's Island and leaves about 2,000 people a day on the streets. We also have the safe injection site, the nation's first safe injection site, which is great, saving a lot of lives. It also means we have a lot of excess drug dealing on the streets and in the spaces around 126th Street where it's located. So the small businesses around here have a very unique challenge. They got together in 2013 and created a merchants association, which became Uptown Grand Central. So previously, I've spoken to this group about a different needs assessment that we did. I think you can see it on the screen, right? This
Yes, but if you want to make full
Get
screen,
bigger. Let's see.
like put
How do
it
I
on
do that?
presenter mode. See the little like easel looking thing next to on the bottom right-hand corner where there's the zoom option. There's like a little easel. Yeah, yep, right there. Yeah. If you
There we go. Okay, cool. Okay, wait, there we go. So this is one of the first needs assessments that we've done. We've done a lot of needs assessments over the years, and I will tell you, every single one of them that we've done comes out the exact same way. The people want cleaner streets, both businesses and residents. People want to feel safer on their streets. And so one of the things I just wanted to share with you today is over surveying, because we pretty much have to do a survey for nearly every single grant that we get. And everybody's tired of it because every single question is, what do you want to see on the streets? And they want to see them cleaner and safer. And then it's really hard to deliver on the things that people want. So this is a survey that we did back, I think, in 2015. But our most recent survey has been as part of the formation of a business improvement district. East Harlem is the only community district in Manhattan that doesn't have a business improvement district. For those of you who are not familiar, whenever you're in a neighborhood and it feels generally clean, generally safe, there's some public art, there might be some lights for the holidays. Generally, there's a business improvement district in the area. The city doesn't fund things like that. It has to be privately funded. So in business improvement districts, each of the properties that are in the district pay an assessment that becomes the budget for things that make the neighborhood cleaner and safer and more beautiful. We got tapped to start the first bid in East Harlem about 3 years ago. And so we gathered a group of stakeholders who you can see, some of them here, not all of them, but got together and started to figure out what would the catchment of the bid be. It took about 3 years of conversation. We ended up with the properties that you see in green. This is East 125th Street this way, Lexington Avenue here, which is one of our most crucial intersections. And what we're looking to do is fund the things that through all the surveys that we've done over 10 years, people want to see. These are some of the things that Uptown Grand Central does right now, but we do on a very, very limited budget as a very small nonprofit. Our nonprofit is just me, which is why I was also running the farmers market, and a cleaning team. And so what we do based on just the donations and grants we can get, we have a cleaning team. Anytime you're on 125th Street and see a yellow trash bag, that's us. We sometimes do community cleanups to get neighbors involved as well. All the murals that are around 125th Street, Lexington, 3rd and Park are done by artists from Uptown that we engage to come help paint. We do the holiday lights in the winter. And this is where we just were. Farmers market, and also large community engagements, such as Party on Park, which is a big street festival we're doing along Park Avenue this weekend. And then we also activate the space underneath the Metro North at 125th and Park with all kinds of things to try to just make the space more activated and family friendly. And we also try to make it safer, although we don't have a lot of way to execute on that, being that we're just a small nonprofit. So the way that we try to do it is by building community connections between our small businesses. And these are some of our longest small businesses that you see here. La Lechanera, which is one of the oldest Puerto Rican restaurants in East Harlem, the Brownstone, and Sisters Cuisine. So when we started the bid process, it's actually a pretty mandated process by the city because the city wants to make sure that the proper outreach is done. So this is kind of the first time I'd ever done an outreach process where I had the city checking every single thing I did to make sure I did it properly. So we first started out with a needs assessment, which we mailed out to every single address in the area and also went door to door and emailed it to all of our stakeholders. And believe it or not, the results were that they wanted to see the area more clean and more safe. Not rocket science. And so we did about 3-year process of trying to figure out all the logistics of the bid and what it would be about. And then we launched outreach last October, 2023. We launched with some press to make sure people knew what was going on, what a bid was, what the goals are. And then the next process, and this is part of outreach too, is to get statements of support. So this is an interesting outreach process and not really an academic one, because what you have to do is you have to get the stakeholders in the area to sign to say that they want to see the area more clean and more safe. And if you are a commercial property owner, it also means that you're agreeing to pay an assessment, which can be anything from like $500 to some of those really large developments that are coming in advance of the Second Avenue subway and some of the other developments. They could pay up to like $40,000 or $50,000 a year. So it's outreach with a twist. And it went really, really well. The outreach process went really, really well. I think because we'd done a lot of communication with stakeholders before then, and also because, you know, I'm beating a dead horse, but the community really wants to see it cleaner and safer. So after we launched the outreach process, which consisted of the media and then the one-on-one contacts, people whose properties were not in the district came back to us and said they wanted to be in the district. So we had to add on some yellow properties that were like, please let us in, let us be part of this initiative. It also consisted of, as mandated by the city, outreach meetings. So we had to do a big mailing. We had to pay for the stamp and the printed mailer. Went out through a big mailing house to every single address within the district. And then we had public meetings at the Caribbean Cultural Center that were pretty well attended. People came out and asked questions about what the goals were, and then also, of course, if they were going to have to pay anything. And then we also did another round of outreach, which was street outreach. That is my son, Kai. And we went up and down the street, went to every single storefront, which had already been visited many other times, and then also did extra outreach in some of the residential buildings that asked for us to come and do additional presentations. Also, it's really, really well known that this is what the community wants. So we also had support from all of the elected officials for the area. And at the end of the day, got support from, you have to meet a 50% threshold. So we met the 50% threshold and didn't have a single no vote. If there was somebody who didn't vote, who wasn't so sure about it, they didn't vote no. And this is just, I won't go through all this. It's just like documented more of the outreach process. But it's been a really interesting journey because it is a different process than just trying to gather information, new information. And it's more like outreach. It's more outcome oriented because once it goes through, then we will have a budget to actually deliver the things that the community wants. So then I'll say one last thing and then I'll quiet up. So the next phase is we have presented it to, it's a mandated process. So we've submitted it to the Small Business Services of New York City. Next week, I have a presentation to all the agencies in New York City. Then we go to City Planning, Manhattan Borough President, Community Board, City Council, and then the mayor, and then the state comptroller, and then back to the city. So I'm excited. I'm excited to finally do a survey that's going to end in some results that we can deliver to the people who need them. I'll be quiet.
So many great initiatives like across the 3 organizations. It's mind-blowing. And to really just think that you're all like centering community voices to really focus on what's important. That's amazing to see. And we have some questions for you all now. We're going to start with Luz. If you can just describe a particularly challenging or successful community needs assessment you've been involved in and what key lessons can be drawn from it.
Yeah, I think that based on just what you saw in the presentation, whenever you go through a community needs assessment, everybody does it differently, as you can tell from all the different groups here that presented. But also, as you're going through that community needs assessment, the importance of centering community and the importance of prioritizing. I think for a lot of us that are doing this community work, we want all of these issues to be addressed, and I do too, but I only have so much capacity and so do the community members. So having that honest conversation with community members from the beginning was so important so that they didn't feel as though we were leaving the rest of the issues behind, but rather this is what we can do here right now with our team and our time and funding. Let's think about the future in terms of other issues that we also need to address. And so that's where we've continued to apply for more and more funding to address the other ones. But for me, that was very challenging because, of course, I grew up with the mentality of always being a grassroots organizer. My mom was also an organizer, so I very much come from that background. And so for me, I just wanted to immediately be like, yeah, we're going to address all these issues, and being like, I have to also be honest, and we can't. And so having that honest conversation and having participatory methods and conflict resolution skills are so important when we are having conversations with community members. But it was the fact that I've already had a lot of experience facilitating conversations around decision-making and decision-making processes that allowed me to be able to really center their voices, and then our voices were there just as a reference and a secondary, literature to be able to be cited, but not necessarily as the main people carrying that forward. And again, that was a big challenge for people who are so used to being the ones going into community and being like, this is what you should focus on, because that's what other researchers were telling me. They're like, you should do it this way, you should do it this way. And I'm like, no, I don't think that's the way we should go about it. So for me, that was one of the challenging, but also the most rewarding part of doing this work, is acknowledging that these decision-making processes are so important, and that as researchers, we need some of those skills to be able to center the voices of communities. So that was a big challenge, but also a big lesson for the work that we're doing now and the strategies that we put forth whenever we're making decisions with the community.
That's such an important lesson to learn, Luz. And I feel like it's a constant journey in executing it the way that we want to and the way that we have in our heads. It's not always linear. So I appreciate your honesty about that challenge. Tanya, I have a question for you. I'm just hoping you could speak to the role that you think focus groups and interviews and really talking to your constituents at Voces plays in uncovering the real needs of the community that you're trying to serve, especially when like the quantitative data, the numbers don't give us the full story.
So Voces Latinas works very much so on the promotora model. So it's reaching community through someone who has lived their same experience. And when people have that same lived experience, they have a different understanding. Voces Latinas is incredible. The majority of our staff are people who are coming from their country, who have processed immigration, not only to say like I went through USCIS, I went through ICE, but also I processed it in my soul. I processed it mentally. I went through the trials and tribulations, and I understand that right now you're feeling like there is no answer, but let us in, let us help you. And I think that once you have those honest conversations, especially with our roots as an HIV prevention organization, to someone be able to say like, hey, I'm living with HIV too. Right. And those kind of things make such an impact that then clients will turn around and say, well, you know what, I can be open, I can be honest, I can tell you what it is that I need. And it's something from the smallest thing that they walk through the door and they have a cup of coffee waiting for them. Right. It was a huge impact when we had new migrants coming in and they were staying at the shelters when everything was like booming and there was so much need, that when clients came in and would say like, hey, do you need a cup of coffee? Do you want a tea? And they would be like, wow, I haven't had coffee in 6 months. It was something so small that offering them that cup of coffee opened the door for them to tell us what is their needs, what are they lacking, how can we support them? And I think that the promotora model is so impactful in that portion of the lived experience. And even if, for staff that have not lived the experience, they have a very strong connection, whether it's like, once removed or something along those lines, so it's like, I haven't lived an immigration experience, but I'm a first generation child, right? And so that makes a huge impact for me because I think all the time when I do my work, what if my parents had this opportunity? How can I make this impactful? And that kind of connection to community also just opens the door for people to feel comfortable and really tell you that qualitative piece, right? Because The quantitative piece is just like how many unique individuals, how many services did you complete? But what is the impact? Right. And I think that when we introduce that promotora model and that connectivity with community, that's where we get the qualitative research.
Yeah, I mean, and hearing both you and Luz speak just back to back right there, it's just that tenet of like honesty, commitment, just being like clear with where you stand and where you're at can help resolve, in Luz's case, you know, conflict, help you get on this path of decision making. And Tanya, in the case of the work that you do, can really just allow people to see the humanity and open up. But in each of these cases, that commitment to just being vulnerable and honest with the people that we're working with can go a long way. Tamneed, I think you have the next question.
Yeah, and the next question is for Carrie. And how can communities use asset mapping to not only identify needs, but also empower local stakeholders in the research process?
I would say, you know, after doing this work for 10 years, we have done plenty of outreach and have realized like there's some strong partners along the corridor and there's some people that are never going to respond. So by the time we did this, it was no longer the hopeful stage of maybe if I try harder, I will get this one LLC from Long Island to respond to my survey. They're not going to. So you know, from this process, we started with assets because we're like, we're going to start with the partners that we know want to make this community stronger, and we're able to build a team of the Caribbean Cultural Center. That was one of our chairs. They want to see this area. They want to see the area's culture be displayed stronger, instead of what people currently think about East 125th Street. Positive Workforce, it's a workforce training organization. They want to hire people and put people back to work. So we were able to put those people together along with some of the affordable housing developers, some of the small businesses, and create a strong committee that was like the best of East 125th Street. It was our assets. And you know, and going forward, we are, you know, our job is going to be to make the corridor a stronger and better place. So I'm really hoping that we can engage, go back to some of the players that haven't been engaged before and see the good work that's going on and be engaged. We do have a lot of service providers, and everybody's kind of in their own heads and in their own buildings and doing their own thing. But we need to get all of the stakeholders to understand that our streets and our spaces and our sidewalks are our shared responsibility, and to get everybody, you know, engaged with that. Because there's a lot of organizations that come to East 125th to help the homeless and the drug addicted and all that, but we have people that live here too, and they have a voice, and they need their voices represented as well.
Yeah, so I guess just picking up on that, and this, anybody can jump in on this, you know, I think a big goal of the work that each of you do is to really make sure that underrepresented voices are included in the needs assessment process, and that that those are the voices you're engaging. And we know that in any process, you're not going to have 100% participation, right? You're going to have that Long Island LLC that doesn't want to join, but there are some voices that we really do need to help pull out, but that have just maybe been disenfranchised for so long, just don't trust research processes, just don't want to participate for a whole host of reasons. And I'd love to hear from any of you, all of you, what strategies you think work to ensure that the most underrepresented voices are included in the process, and what can we do to better make sure that that happens as we do this kind of work?
I'll just say quickly, this is not the right answer, so I'm sorry, but like I just stopped doing surveys. Like there are a lot of organizations that want like a grant report for this or whatever. I fake the answers to some of it because I already know what the people want. Like it's and this might sound wrong, but like when you are in an underrepresented community without a lot of resources, the thing that people want to extract from that community is data. And they will take the data and then they will do nothing with the data. And then the neighborhood is left poor and under-resourced, and you're asking the same people the same things. So if it's something where I feel like by extracting more information, we're going to see a result, I will ask new questions. Other than that, I'm just like, this is what I want, and leave us alone. And so you come with resources and something to represent.
I think surveying is difficult. I do agree with Carrie on that. I think that one of our biggest assets is the things that Louis and Carrie have been talking about today, right? Alongside myself, because if we don't have community buy-in, if we don't have community representation, and we don't have stakeholders, there's no way to get this out there, right? And so one of the huge things that Voces does in terms of community mapping is we are on Roosevelt Avenue, right? The same way Carrie is describing 125th Street, Roosevelt Avenue has its characteristics. Everyone says it's a red light district. I'm not going to go there. There's all these things happening. There's gun violence, there's gang violence, and I don't want to be there. But the bottom line is that a lot of the people that are on Roosevelt Avenue are also people that live in the community, right? So I might be a sex worker, but I also live around the block. So I understand that my safety is compromised in two different ways. And how do I extract that data? How do I understand? How do I know? And I think that that's really important to discuss, because if we don't get those voices, how can we know? And how do we know if we don't map the community? So it's all the things go hand in hand, but we do need buy-in, right? And so buy-in is a big thing for community. And if they don't trust you, they're not going to give you real info. So it's definitely gaining that trust.
Yeah, absolutely. And I'm just going to add to both what Carrie and Tanya said, that it really all goes back to community. If this work would not be possible if it wasn't for communities being the ones centered in the whole entire research process or project that we are creating. And so for me, at least personally, as I'm forging these partnerships, is also having the skills to connect with people beyond just the work. And so going back to that lived experience. So a lot of the people who are part of our partnership are all BIPOC folks, but also most of us entered this workforce because we also come from environmental justice communities. So myself and also Dr. Don Robert Semple, who is from Guyana. I'm from Mexico. I immigrated here when I was 10. So both of us ended up having this history of leaving our home countries because of environmental injustices, and then moving to this country and still facing environmental injustices. And so that is really our main motivator of doing this work. And community members want to trust somebody who understands that lived experience. To this day, like when I talk back to my mom, because my mom's a farm worker in Arizona, she's still dealing with the environmental racism in the neighborhood. That is our lived reality. And so for me, I am not as far disconnected from that lived reality. It might not look the same as Jamaica Queens, but we have that shared commitment and vision for environmental justice that we all feel like we deserve. And so all to say that that's why it's also really important to not just have researchers who are outside of the community coming in and thinking that they have like the solutions, but also making sure that it's people who have that lived experience, people who have marginalized identities within these academic structures and understand that this work is really emotionally tolling. To be able to do this work, my gosh, get a therapist, please. Like, get mental health support, because it is really difficult to be able to do this work while at the same time you are healing from your own trauma, from all this environmental injustices and many other injustices. But all to say that I really want to make sure that as we are forging these partnerships with community, to really put forth the people that have been doing this work for a really long time, because I'm seeing so many people wanting to do this work, and that's beautiful and that's great, and it makes me so hopeful. But I also want to make sure that we leave room for the people that have been doing this work and have been marginalized for so many years for doing community engaged work. So I'll just say that there's space for everybody to do this work, but understanding where you're coming in from and your own experience is really going to make a difference in how these partnerships are going to be formed. And so I think for us, because me and my other principal investigator that I'm a partners with, we both understand that environmental justice experience and we're still living it. We have more trust with the communities, and they don't have to explain themselves as to why this hurts them or why it's actually impacting them so much. So at least for us, it's given us an opportunity to heal also personally from some of this, while also professionally working towards changing these structures that allow us to do this work with communities.
That thread of reflexivity, acknowledging your positionality, the importance of representation, like these are all just such important pearls of wisdom you were sharing. So thank you.
I think just to be mindful of the time, we're just going to open it up for the Q&A. So if anyone wants to come off mute or drop your questions in the chat, now is the time.
I just looked at the clock. I was like, how'd that happen? This has been incredible.
Whenever you're engaged in great conversation, that happens.
I'm like, I could listen to them all for hours. Any questions from our attendees? Any parting thoughts from our speakers?
I always want to say that I learn so much whenever we have these kinds of sessions. I feel like even though we're in different spaces with working with different groups, we all have some commonality and similarity across all of them. And so I always learn a new skill, something I wasn't thinking of, because sometimes I feel like I'm a horse with blinders on. And then it's like, oh, was a great opportunity. So thank you all for today.
Yeah, I agree.
Yeah.
It's been
Sorry.
nice to be able to hear Tanya and Carrie, the work that you both are doing, and really highlight the importance that it doesn't always look like surveys. Like, thank you so much for saying that, Carrie, because usually everybody's like community needs assessment, surveys. So seeing Tanya, your work, and Carrie, your work in a very different light than what I'm used to traditionally seeing in academia was very refreshing. It also made me feel very hopeful about the future. So it was great to be able to be a co-panelist with both of you.
Agreed. And it is like therapy. I think it is like therapy to see what other people are doing and to realize that you're not alone and to realize that, yeah, we got to be savvy about what we're doing to protect the communities, that we're working in.
I agree. I just want to echo the same sentiment. I would say thank you to Devin and to Tim Need for bringing us together. We're working in really different sectors, but there's, like you said, that common thread. And I feel like I learned a lot today too, and I'm really grateful for this space. Thank you so much.
Thank you so much, everyone. This was a very insightful and we've learned so much. Thank you for your time. So please join our next session, which is on November 20th. It's going to be on dissemination and action in community engaged research. And please also take just 1 minute to fill out our feedback form. It really just helps us make sure that we're making these sessions better. Thank you.
Harry, enjoy the rest of the farmers market. Thanks everyone for joining. We'll talk
Thanks,
soon.
guys.
Bye.
Bye.